This is a pivotal year for non-communicable diseases because this year, 2025, we're going to have the fourth UN high-level meeting on non-communicable diseases. Many people die prematurely from NCDs, and you find this mostly in low and middle-income countries, where over 2/3 of deaths from NCDs that occur prematurely come from low and middle-income countries, and that speaks to the challenges in the prevention and control of NCDs in these low and middle-income countries. In Africa, in general, NCDs remain a very key issue. On average, responsible for over 24% of deaths each year in the continent. We definitely really need to look into the issue of financing for prevention and financing for care, because when you look at financing for care, most of the cost of care in most African countries really comprises out-of-pocket expenditure. So people are paying for their care from their pockets. In my country, Cameroon, for example, insurance is not really something that is much spoken about. It's not very available. It's not very, very present. Less than 2% of the country is insured for health. I also want to encourage the African countries, heads of states, heads of governments, to really prioritize NCDs. I'm calling on political will. And my message to them is, you don't need to be affected by NCDs before you think it's important. The leaders need to commit to effective international collaboration as far as NCDs is concerned. Very effective international collaboration that should be able to define what we want to do and how we want to do it, so we could be able to achieve the goals by 2030. And lastly, the leaders need to commit to effective community engagement back home. There's some of us who only meet our leaders when we are able to meet them in high-level meetings. But we need to be able to meet our leaders back home. We need to be able to speak with them. We need them to give us a listening ear, because we are also experts from civil society. We are also leaders in our own right. And we want to have conversations that are very meaningful with respect to what we experience on a daily basis around the issue, the burden of NCDs in our countries.